Okay, this video is just a little short clip on how I, as a clinician and as a surgeon, can tell if someone needs an upper blepharoplasty or an upper eyelid lift. So I'm not wearing any makeup today, mostly because I'm too lazy to put any on, but also so that I can show you just how I look and how my eyes look. Now, obviously, I'm Chinese, I'm Asian, so the anatomy is a little bit different for me. For Asian people, our biggest concern is having a nice double eyelid, or being able to see this crease, which most other ethnicities have naturally without any extra help. Now, I haven't had anything done to my eyes, but I can tell you that I've always liked my left eye more than I've liked my right. I find that the crease is more distinct and it's more symmetrical with the shape of my globe and also with the shape of my brow. Now, the nice thing about these days is that with microblading, with microcurrent, with light-based therapies out there, there are little things that we can do to kind of tweak and enhance what we're given without going the surgical route. But usually by the time you come to see me, it's because you've either exhausted all of those other avenues, or you're just ready and you want a result without having to wait or to have to do repeated treatments before getting some sort of result. So in a typical patient, when I first see them, I look at the position of the brows and also at the eyes themselves. So it's never just the eyelid. There are some people who are not appropriate for just the eyelid surgery. They need both because depending on where the position of their eyebrows are, they may have what is called browtosis. Now, browtosis means that your brow itself is heavy. Now, this is probably what's going to happen to me as I continue to age, which is a little bit depressing. But you can see when I'm holding my brow down how I've lost the arch of my eyebrow here. And that also gives me more of a hooded appearance to my eyelid. And as this continues to happen, this is when we see people with the really heavy eyelid skin, especially on the outer corners of the eyes. This can also serve to kind of fold over and hide the eyelid crease itself. It makes it difficult for people to put their makeup on because they're always trying to pull the skin up, and it just smears or it leaves, pigment in creases. And it's also difficult for the mascara, again, because now you're trying to put on pigment and it's smearing up onto the eyelid skin. Now, on top of this, there are also fatty deposits that occur along the eyebrow. Typically for the upper eyelids, this is where we see the fullness. And if you look at yourself in the mirror and you see a little puff here that you've noticed for a while and just seems to be getting worse, that's probably the medial fat pad. And I tend to go in after that and tease it out during the surgery. There's also a lacrimal gland, which is the tear gland that sits under the lateral or outside portion of the orbit here, and sometimes that becomes ptotic. Now, ptotic means that it droops, and when it droops, it can also create a little bulge or fullness here, and sometimes we have to tuck it back in and pexy it back up, again, to give you that nice kind of contour to your upper eyelid. Now, again, when I'm looking at a patient with a low brow, I'm looking to see how low it is in conjunction to the bone itself. If I'm unable to fit a finger between the brow and the arch of the eyebrow, that usually tells me that this person needs a little bit of a brow lift. Again, the other things I look for when I'm talking about that are how many forehead wrinkles there are. If they're constantly using their forehead to lift their eyebrows just so that they can see, that again tells me that their brow has become quite droopy and ptotic and probably needs to be repositioned. One thing that I do is I have you close your eyes during consultation and be completely relaxed, and then I block your eyebrows and have you open. And if when you open, you're feeling pretty heavy and you can't open your eyes all the way, again, that tells me that there is something going on up here that we should correct. Now, if you don't have that issue and we're just looking at the eyelids themselves, again, if we're talking heavy here, then it's a determination of whether it's skin, whether it's fat, whether it's a combination, and whether or not there's a droopy eyelid component to it. And again, there are different measurements and tests that I do during your consultation to see where your eyelid margin is in comparison to your pupil and whether or not this needs to be adjusted. And it can be uneven or asymmetric side to side. Now, the other thing I look at is your skin quality. If you're pulling your skin and it stretches way the heck out here, and when you let go, it doesn't snap back, you've lost elasticity and you have skin excess. So that tells me, yes, you'll probably benefit from having some of that skin taken out. And like I said before, if you have a puffy spot here that doesn't seem to go away, I'm going after the fat. So there's like a bunch of different little things that when I first come into the room and we're chatting, I'm already noting about you. But I do walk you through this process so that you can see for yourself what I'm seeing, and then we make a plan from there. Now, the lower eyelids is a whole different area, and we will tackle that on the next video. Bye.